Um, welcome. It sounds like it is a very important topic because we're already getting a bunch of questions. If you have any questions, please send them to all panelists so Sandy can actually see them as well. Welcome to our second 2022, the Employment, Health, and Wellness webinar series for people with intellectual and developmental disabilities. The series are hosted by the HealthMatters program in partnership with Project Search and are funded by the Ohio Developmental Disabilities Council from the U.S. Administration for Community Living and the Centers for Disease Control and Prevention, National Center for Chronic Disease Prevention and Health Promotion through the Healthy Brain Initiative Award. Contents are solely the responsibility of the authors and the presenters and do not represent the official views of the ACL or CDC. Today's webinar is on understanding SSDI, SSI, and work incentives. This presentation will provide an overview of how work impacts SSDI, SSI, Medicaid, and Medicare, and the work incentives that encourage financial independence. The participants will learn about Social Security disability benefits and associated healthcare programs such as Medicare and Medicaid. You will also learn about the impact of employment on Social Security disability benefits and associated healthcare programs. I wanted to welcome our presenter today, Sandy Needler from the UnitedHealthcare Community Plan of Texas Rehabilitation. She's a Rehabilitation Employment Manager. In her role at the UnitedHealthcare, Sandy advocates for employment for individuals with disabilities in the community, supports members with disabilities in navigating the journey to employment, and is actively involved in the UnitedHealthcare's disability hiring and retention initiatives. Welcome, Sandy. And just as, again, housekeeping, we will record, or we are recording this webinar. PowerPoints, all the handouts that Sandy mentions or shows will be made available on our YouTube channel, and I'll post that information. Also, we will be, once the webinar is done and archived, we will email each one of you and let you know that it's up on our YouTube channel, and you'll be able to click on the link and go to the recording and all of the resources. Please put all your questions in the chat box. I will make sure to monitor it. All the questions will be answered in the last 15 minutes of the presentation. And without any further ado, Sandy, welcome and take it away.
Thank you so much. I'm excited to be here. This is a big topic. So I want to tell everyone I'm going to move pretty fast. But I will be going over, so we'll be actually looking at a calculation sheet or two. And I think that will be really helpful for everyone. So I am going to talk fast. This is a lot of information, but it's certainly information that I know all of you can use. And I'm very happy to have this information out there because it needs to be out there much more than it is. So, all right. So the first thing you need to know is that there is a definition for disability under Social Security. It is a medically determinable impairment. You have to have the condition for at least 12 months for it to be considered a disability under Social Security. And you also have to not be able to perform SGA work, that substantial gainful activity, because of the impairment. These are all three of the criteria have to be met for you to be considered an individual with a disability under Social Security. There are periodic medical reviews to determine eligibility. Those are called CDRs. Again, we're just going to be scratching the surface here, but you just need to know at this very high level that there is a redetermination of eligibility periodically for most individuals. The individuals are not going to have to do CDRs, and this is pretty important while they're using their ticket to work. Okay, so an individual will not have to go through all of that process and possibly not be considered an individual who could continue to be disabled under Social Security if, you know, in another instance. So we'll just move on. Oops, going the wrong direction. Okay, so here are some basic comparisons between SSDI and SSI. Okay, SSDI is actually called Title II. It is an insurance benefit, meaning that you pay into it, and just like we pay into Social Security for working that we're going to get after the age of 65, this money comes out of the same trust that money comes out of. So this is about insurance, it's about paying in and getting a little bit back to supplement your income. Anyone who's receiving SSDI is also going to receive Medicare. Okay. And again, Social Security uses certain work incentives to determine what the substantial gainful activity is for you. They are individualized decisions. It's important to know from the very beginning, most people think that there's a dollar amount that you can work up to that dollar amount. If you work over that dollar amount, your benefits stop and are gone. And that is not the case. So substantial gainful activity is a decision, and it is based on your individual circumstances and all kinds of factors. So be open-minded about work. That's the main message, is be open-minded about work. So SSI is supplemental income. It's never been intended for an individual to be provide all the money an individual needs to live the full life that they want to live. It is meant to be supplemental, intended for basic food and basic shelter. You know, the max benefit is $794, I think, somewhere right there. And you know, that doesn't cover very much, right, realistically. So again, supplemental. Benefits, beneficiaries who are receiving SSI receive Medicaid, okay? There are also periodic redeterminations in SSI, like in SSDI, but it's a little bit different. And this is really important. The resource amount is $2,000, just same as in Medicaid, okay? So your countable resources must not exceed $2,000 as of the first moment of a given month. How they know that first moment, I have no idea, but they do. So that, again, is something that you really have to keep in mind for SSI. Thank you, 841. Thank you. The SSI maximum is 841 for 2022. I appreciate that. So this is, more people end up having an issue with their SSI because of the $2,000 resource limit than they do because of their income. So that's something to keep in mind. Okay, we're going to dive into Title II a little bit. There are 3 types of Title II SSDI. Okay, there is the first one. It's DIB. It's I guess the main one. Okay, it's what most people think of when they think SSDI. They're actually thinking disability insurance benefits. Okay. There's a second type called childhood disability benefits. Now, this is actually payable to a disabled adult child of an insured worker. So let's say it's this is a child of a parent who has retired from work. Once that individual turns 18 and they have the disability before the age of 18, they can begin to receive what is known as childhood disability benefits. Okay, and again, that the amount that individual receives will depend on how much was paid into Social Security, lots of factors, okay? But again, this would be a lifetime benefit. It also is paid to a disabled adult child of an individual if they are deceased, okay? Again, the disabling condition has to begin prior to the time of the person reaching the age of 22. And yeah, I think I've said all this. Okay, so this is the reason I give more details about this is because this is when we start talking about SSDI and SSI, this is probably the most common where an individual may be concerned because they may be receiving SSDI because of a parent, and they're receiving SSI and they really are worried about losing both of those. So I wanted to give a little bit more detail about the childhood disability benefits. There is also a disabled widow or widower's benefit, which I'm not really going to go into. But that's one of the 3 types of Title II. Okay, so, I think that slide's in the wrong place, but anyway, all right. So Title II, social SSDI, remember that would be the DIB, is a benefit that replaces wages for workers who have already paid into the system, all right? The payment amounts are based on the wages of the individual, all right? The number holder is that individual, okay? The number holder, the person who is receiving the SSDI, must not be able to engage in substantial gainful activity. That's a big word when we start talking about benefits. Due to a physical or mental impairment. And the disability definition for Social Security is that the physical or mental impairment which can be expected to result in death. It's not a good sentence to have to say, but that's what Social Security considers, okay? SGA means the performance of a significant physical and or mental activities in work for pay or profit, or in the work of a type generally performed for pay or profit, regardless of the legality of the work. So what's important to know about SGA is, again, it is not the same number for everyone. It is a decision from Social Security. They determine what your SGA is, and SGA is really about a pattern of work, okay? When we get into talking about the actual calculations, you'll see how this comes into play just a little bit more. Okay, a little bit more about SGA. I think I've said a lot of this, but again, SGA is a decision, okay? It is not a concrete dollar figure that Social Security, it's not, you don't get a chart every year and this is the limit, and if you make more than that, your benefits go away. It seems like that, and that's definitely the idea out there, but it is not that. And we'll go into a little bit reasons why, okay? For Title II, SGA is determined by using several different tools. Okay, so we're going to learn a little bit about each of these tools, and this is something that is, a lot of people don't know about. Okay, so these are important if you're receiving Title II benefits, and it's important to know too, if you're receiving SSI and you get a job and you work for a period of time, at some point you will begin to receive SSDI. So these are always going to be something important for you to know. Okay, so there are subsidies, special conditions, impairment-related work expenses, which we'll see on the SSI side as well. There's something called income averaging, and then an unsuccessful work attempt. Okay, so subsidies and special conditions. Essentially, this is a concept where if you are receiving supports in the workplace to do your job, the employer can set a dollar amount to what those supports are. So for instance, if you're working with a job coach, the employer assesses your contribution in considering the job coach's contribution, and they set a dollar value, okay? So that impacts what your substantial gainful activity is. Impairment work expenses, impairment related work expenses, IRWEs is what they're called, okay? And I'll probably say that more often than impairment related work expenses. So an IRWE is any kind of expense that you encounter in your day-to-day routine that impacts your ability to work, okay? So IRWEs are a very powerful work incentive under both Title II and under SSI. And there are lots of IRWEs out there that people may not consider to be IRWEs, especially when we start talking about the BWEs. So we'll get into that a little bit more. Income averaging and unsuccessful work attempt. Okay, so these are some of the safety nets under Title II. Income averaging, so let's say you're making $450 one month, and the next month it's $900, and the next month it's 270 and there's just fluctuations, Social Security will take a period of time and they will average that amount in determining what your SGA is. It's not going to be based off the highest number or the lowest number. They're going to take a pattern of work and average that amount in determining your SGA. Unsuccessful work attempts, let's say you work for just a few months and you really want to maintain employment, but it's just not working for you. Social Security is going to consider that an unsuccessful work attempt, and it's not going to be a factor at all in determining SGA for you. So you basically start over, get a do-over if you end up coming back to work and trying again. Okay, the trial work period. This is a major work incentive under Title II. So basically what the trial work period is, it's a 9-month period within 60 consecutive months. This is where it gets complicated, okay? It's a 9-month period within 60 consecutive months where you are able to perform substantial gainful activity, okay? Again, that number is established by Social Security, okay? It is different for everyone. It is an individualized number, okay? So the Social Security determines the substantial gainful activity amount. And if you work 9 months within a 60-month period and you make over that SGA number, then those are considered trial work periods. Each individual gets 1 trial work period per disability. Okay, that's important. And that's a big factor when putting all of this into play. Okay, and we'll look at that a little bit later. Now, again, the 60-month period is a rolling calendar. Okay, it's not static. That's also important to know. The 9 months that you have do not have to be consecutive months. It can be a January, a March, April, May, and then, several months down the line. Does that make sense? It is not consecutive months. Okay. Once you use your trial work period, your 9 months, then you go into the next month, the 10th month essentially is your succession month. That's the month, excuse me. That's the month where your benefit amount technically stops. You still receive it for that month, but that's the change, okay, from before your trial work period to after your trial work period. There are 2 additional months of grace period after that. So you can work for an entire 12-month period, and it doesn't matter. Again, you can be making more money than your substantial gainful activity, but in the trial work period, it doesn't matter. You can make as much money as you can in that period. Okay. And that's really, think about that. You have 12 months to make as much money as you can before you really have to start worrying about or knowing that 12 months from now, I'm going to, there will be an impact to my benefits. Okay. But 12 months is a long period of time. Okay. So once you go through your trial work period under Title II, you go, your next phase is something called the extended period of eligibility. This is another safety net under Title II. It means that you can be re-entitled to benefits for an additional 36 months. Okay, once you have gone over that SGA amount. Okay, so if in that 36-month period you fall below SGA, your benefits can start again. Okay. And again, if you aren't performing SGA at the time the 36-month re-entitlement period ends, your benefits continue indefinitely. Okay, that's huge, right? So let me say that. Yes.
Can you clarify, is it or is it not 60 consecutive months? Rolling 60 consecutive months.
It is a rolling 60 consecutive month period. Social Security is gonna look for over 60 consecutive months if you have made over the trial work period threshold amount. One, they're looking at that, and two, they're looking at if you have made substantial gainful activity, okay, over that 60 rolling month period. Let's see. Okay, so the main effect of EPE is that it permits a benefit reinstatement during the reentitlement period. Okay, again, this is huge, right? So you have 3 years after your first year that your entitlement can begin again. Okay, so, and of course, we just said if your beneficiary isn't performing SDI at the time of the 36-month reentitlement, the benefits continue indefinitely. Okay, so some pretty important safety nets built in. And again, all of this happens, you know, you are going to be in touch with Social Security. You're going to be reporting your income every month. And when you find yourself in a situation where you need those benefits to be reinstated and you're in your 36th month, it's just about notifying Social Security. After the extended period of eligibility, you begin a period, it's phase 3, it's a period called expedited reinstatement. It's a way just to jumpstart your benefits again. You have it for 60 months after your benefits are terminated, okay? It sounds kind of scary, the word terminated, but again, terminated doesn't mean they erase you from the Social Security database, okay? You're still in the system, all right? So that you can get your benefits reinstated if you find yourself in that situation. Okay. All right, so we have, I'm actually going to skip this. We'll do this. Yes.
In the 9 months of trial period, what about the 200 asset limit for your bank account?
Well, now you do still have to worry about the $2,000 resource limit. Okay, that is always a factor. But you can use an ABLE account, set up an ABLE account, and that money isn't calculated into that $2,000 resource limit. Okay. So we have a couple of examples here. I'm actually going to show these at the very end, or we're going to work on these at the very end, because I want you to see how the interplay between SSI and SSDI. Okay. So tied to that. Okay, so let's talk a little bit about SSI. SSI is probably, when people think about cash benefits from Social Security, most often they're probably thinking about SSI. But remember, SSI is only intended to cover basic, very basic food and shelter. Okay, it's meant to augment any other kind of income. It is not meant. There's this mystique out there that this is the amount you receive and this is all you can receive, and if you exceed something or you mess with that amount, you know, your cash benefit goes away and it's just gone forever. That is absolutely 100% not the case. Okay. When you apply for SSI, they calculate your SGA, and they only do that one time for you. Okay, that's also important to know. It's not something that's recalculated like it is under SSDI. Okay. After the initial eligibility for SSI, SSA, Social Security, continues to assess the countable income and resources of all SSI recipients on a monthly basis. Now, it's important to know that they are looking at everything on a monthly basis. Remember, they're looking at that $2,000 limit at the first moment of a given month, right? So they do everything on a monthly basis, but in reality, they're looking at 3 months ago. Okay, that's just something to keep in mind. They're not looking at the current month. They're probably looking at 3 months ago. Again, there's that eligible, the resource limit of $2,000 to maintain eligibility. Okay. Now, if you exceed the $2,000 limit, you are not exited from SSI. You go into what's called suspension. You're not terminated, you're suspended for a month. Okay. As soon as that resource limit is under the $2,000 limit, again, your benefit would continue. Okay. So it's important to know that you do not terminate if you exceed the $2,000 limit. So there's a magic number or magic word in here. It's countable. Okay. Countable income is what they're using to determine your SSI benefit. All right. Countable income is not your gross wages. Okay. We'll see that a little bit later. Okay. But in essence, right, this is the overarching concept. The more countable income you have, the lower your cash payment will be, right? And that's the thing that everyone fears, right? They think the more I make, the less I'm going to get. And that is true, but it's not nearly as devastating as it sounds when you actually start to look at how the numbers are calculated. Okay. And living situation is a factor. We could talk about this for days. And marital status is a factor. There's all kinds of factors. So this, again, is just very high level. What you need to know is the $2,000 resource limit. And you need to know that the more countable income, and countable is an important word, the lower the cash payment. Okay. SSI considers income to be anything an individual receives in cash or in kind that he or she can use to meet basic food and shelter needs. Okay. If you are have some sort of barter arrangement, Social Security is going to consider that in kind income. Okay. And they are going to factor that in determining what your SSI cash benefit will be. Social Security does not count items as income for SSI if they are not food and shelter. Okay. And a person can't use them to obtain food and shelter. Right. So that's important. If that income can't be translated to paying for food or shelter, it's not considered. Okay. There are two types of income. There is earned income and there is unearned income. Earned income is any cash or in-kind item that a beneficiary receives in exchange for work performed or as remuneration for work effort. Okay, so if you get paid for something, that is earned income. All right. Unearned income is any cash or in-kind item a person receives that isn't earned income. So under this scenario, SSDI, the cash benefit for SSDI is considered unearned income. Okay. If there is an annuity, if there is some sort of payout, all of that is considered unearned income. Okay. If you win the lottery, that's going to be considered unearned income. Okay. So let's talk just a little bit about earned income. Wages. So SSI counts gross earnings, but again, we're going to countable again is the important word. Okay. SSA counts earned income at the earliest of 3 points when the person receives it, when it's credited to your account, or when it's set aside for your use. And again, Social Security is determining earned income for each calendar month. This is really another really important thing that I need everybody to walk away from this presentation with. You have to report your income. More people get really burned, okay, if they do not. Social Security will catch up, okay. They will figure out where the income is coming from, and you will have to start paying Social Security back, okay. So it is very important no matter how much the earned income or unearned income is, that has to be reported to Social Security. Very important. Okay, so in-kind earned income, the value of food or shelter or other items an individual receives instead of cash in exchange for work performed. So if you're getting room and board for doing work, that is considered in-kind earned income.
Sandy, can you explain again what countable income includes?
Let's put that on hold for just a second because we're going to demonstrate it. And I think it's a little bit easier once you see it, numbers on a page, okay?
Okay, thank you.
Mm-hmm. There are other factors for self-employment. Self-employment is treated differently, but know that self-employment is also, they look at your net earnings. So I'm not going to go into that too much because it gets a little complicated. Okay, so unearned income. Any cash or in-kind item a person receives that isn't earned. Again, so if you are receiving some sort of payment without working for it, and it's, you know, a monthly installment, or even if it's not a monthly installment, it could just be a one-time thing. It is considered unearned income, okay? Title II disability payments are most common form of unearned income. I think I said that. Most commonly, if somebody is receiving SSDI, that is the greatest impact to their SSI because it comes off right at the top, okay? Again, we're going to look at this, we're going to look at numbers and it kind of makes a little bit more sense. SSI always addresses Title II first. In any instance, if someone receives both SSDI and SSI, they're always looking at SSDI first because it's insurance, it's paid into, okay? It is treated very differently from SSI. They are two different divisions of Social Security that do not talk to each other. It's very strange. You would think they'd all be under the same roof, but they're not. And again, we're determining SGA in each calendar month, okay? All right, so when we start talking about in-kind support, the amount of in-kind support that individuals receive can vary greatly. So to simplify the system, Social Security put in something called value of the 1/3 reduction rule into place. And basically it means that they're going to count 1/3. Let me read it exactly it is because I don't want to mess it up. SSA reduces the SSI payment by a full 1/3 when the eligible individual lives in another person's household for a full calendar month and receives both food and shelter. Okay, so they are going to take a 1/3 amount of what that is, and that is called the VTR. They apply that kind of universally instead of trying to figure out how much support each individual is receiving, because that is, you know, an unending, changing, evolving situation for each individual. So you most commonly will see the value of 1/3 the VTR applied if someone is receiving in-kind support and maintenance. And that is if you are a 24-year-old adult who's residing with someone else, you're receiving in-kind support and maintenance. Okay, it gets a little complicated because if you're paying rent, that changes things. But again, we can't dive into all of this, but you need to know that there is the 1/3 rule. There is also something called the maximum value rule. If unearned income value of the beneficiary's ISM, that's your in-kind support and maintenance, is high enough, Social Security will cap the amount that counts against the SSI beneficiary. So technically, they're gonna look to the VTR first, but that's again is a conversation with Social Security. So you can they may have to do the maximum value rule. Again, it's not cookie cutter for everybody. So again, this is very much a conversation with Social Security determining which one fits better for the individual. And it's not what it's in favor for the individual whatever the amount is better for the individual, not whichever amount is better for Social Security. Okay, so that's important to know. All right, so now we start talking about work incentives. These are the factors that will change what your countable income can be or will be, okay? So the first one is for individuals who are under the age of 22 and regularly attending school. This is a big one, okay? It is, so essentially it's any student, air quote student, who is under the age of 22 can keep basically what they're making up to a certain amount without it impacting their SSI. So again, now remember, you still have that $2,000 resource limit. That is always there. But again, there are able accounts and there is different forms of using that income to where it offsets, okay? So in 2020, the maximum amount that you could make as an exclusion under the student earned income exclusion is $7,670. It's a lot of money for a young person to make that is not going to impact their SSI cash benefit. Okay, they can make more than $1,900 in 2020. The numbers do change from year to year. I'm sorry, this is an older presentation and I haven't updated it. It's probably pretty close to these numbers though. There's also something called the general income exclusion. Now, this is something that every single person gets. It is a exclusion of $20 straight off the top, okay? And again, it's an exclusion that everyone receives. If they have no unearned income, the $20 is taken later out of the earned income. But we'll see that in practice in a minute. So again, the student earned income, this is not one that is probably used, but this can make a huge difference in a young person's life in setting someone up for financial independence, okay? Because again, this amount is not considered as part of your countable income, and it's excluded for SSI up into the age of 22. Okay, there is something called the earned income exclusion. Social Security excludes the first $65 of earnings after it subtracts the SEI, SEIE, and or the general income exclusion. Okay, so it's important that how they deduct the dollars, they do it in a very certain order, and that is important. Okay, and again, it's to benefit the individual. The 1/2 earnings exclusion or the 1-for-2 offset. Okay, this again is a work incentive. So the 1/2 exclusion permits Social Security to exclude half of the earnings that remain after the deductions. So they have well, let's just go ahead. This is probably time to all right, can y'all see the, I hope. How do I make it go down?
Do you want to enlarge it? Or
I want everyone to be able to see the whole page.
So that's on everyone else's end. There's on the top, depending what version of WebEx is being used, there's a percentage. So at 32%, you can see a whole page. There's plus and minus on that toolbar that's right on top in between the video or your name and the actual PDF that you're showing. So there's plus or minus, and we can all just kind of use, the users can enlarge it or make it smaller.
Okay. Well, let's see. So I'm going to have to do mine. So help me for 1 second. If I do, let's just see if I do this. Here we go. Is that okay for everyone?
It doesn't change. It's whatever everyone has it set up on their end. I have it at 32%, and that you can view my entire, it depends on the size of your computer screen.
Okay. All right, so let's look at this individual is someone who does receive SSDI in the amount of $492. She had an accident, and before her accident, she had worked for a few years. All right, so her SSDI is $492, and she has just gotten a job to be a customer service representative. She's only going to work 12 hours a week. She would really like to work more because she's interested in maximizing her income to build financial independence. But she is, you know, aware that there is impact to her benefits. And so she wants to look at all scenarios and think about all scenarios through. So we'll show you that in just a second. All right, so her unearned income, remember SSDI's unearned income is $492. We take the general income exclusion off from the very top. So we take out that $20. Everyone gets the general income exclusion. And if it's not, and if you don't have unearned income, you use it down here, okay? So our countable unearned income from at the very beginning is now $472. So if my client is working 12 hours a week and she's making $8 an hour, her gross earned income is $384. And again, this is just simple math, you know, $8 times 12 hours a week. All right. That's how we calculate it. Just very simple. She is a student, but she is over the age of 22. So unfortunately, we cannot use the student's earned income. All right. So we are left with a remainder of $384. We used the general income exclusion up here, up at the top. So we cannot use it down in this next section. All right. So we're still left with a remainder of $384. All right. Now, everyone has the earned income exclusion of $65. So the $65 amount is taken out at this point, and we're left with a remainder of $319. Unfortunately, this individual does not have any impairment-related work expenses. But that is not necessarily going to be the case. I mean, medications, in special transportation in some cases, there is a litany of impairment-related work expenses. Of course, they're very individualized and they do have to be approved by Social Security. But in this case, this individual does not have one. So we're left with our remainder of $319. Now we divide by 2. Okay, remember the countable earned income is what we're trying to get to. So when we divide by 2, we're left with $159.50 as her countable income. So we started with unearned income of $492 plus earned income of $384, but we end up with the countable earned income of $159. Okay, that's half, more than half, right? So we take our countable or unearned income, same amount from up at the top, 472. We add our 159.50, and we end up with a countable income, a total countable income of $631. Okay. So this section right here where it says past deduction, this is another work incentive that we can talk about. I think we talk about a little bit later, but I'll go ahead and say now, it's a very powerful work incentive. It allows you to put money aside that is not calculated into your earned income in determining your SSI cash benefit for a vocational goal. So let's say you want to start a business and you need equipment for that business. Let's say, you want to have a bakery, okay? Whatever equipment you need to buy for that bakery could be set aside as a past deduction. So you can save up the money that you need to achieve your post-secondary or your employment goal, okay? It's a really, can be really maximized under the right circumstances. So let's see. All right. So now, all right. So again, my numbers are old. I apologize for that. But in this situation, the base SSI rate was $7.94. This is a few years ago. Okay. The VTR amount is set, right? So they take out that, remember the value of 1/3. They take out that value of 1/3 if you're receiving in-kind support. Okay. They don't get into how much in-kind support unless you work with them on that. Okay. And it would benefit you more to use the PMV versus the ISM. Okay. There's also an amount for eligible couples. Okay. So in this scenario, it was $7.94. So this individual is receiving the full amount. She lives independently in her own apartment. We deduct the total countable income from the base rate, and we get the adjusted payment of $162.50. Now, clearly, 162 is much, much less than 794, right? But let's look at this. So the adjusted SSI payment is 162.50. She's still earning her SSDI, or not earning it. She's still receiving her SSDI cash payment of $492. And she's getting her gross income. She's working 12 hours a week at $8 an hour. She's making $384. So now her financial outlook, her outcome, after we consider all of this, is $1,038.50, which is much better than if she were only receiving the $794, right? I mean, do you see how it's a powerful, how it can be very powerful? Okay, so we're gonna look now at this second one. Okay, so this is her working 30 hours a week. Obviously, you know, the more you work, the more your income is, right? So in this scenario, she'd be making $960. All right, so she has her unearned income of $492. We take that $20 GIE, the general earned income, right off the top. We end up with $472.60. Just for convenience, Social Security really only deals in full numbers, so this would really just be $472. But so the gross earned income is $960. Again, no student exemption, exclusion. Remainder is $960. We've already used the GIE from up above. We have a remainder of $960. The earned income everyone has, we take that out of $65. We would left with a remainder of $895. In this instance, there's no IRWI. We divide that by 2, and so our total countable income is $447. All right. We're going to add our countable unearned income of $472 plus our earned of $447, and we come to total countable income of $920. All right. So in the end, we are left with her financial outlook is now $1,452.60. All right. So she's still going to be receiving her SSDI for a period of time under this circumstance, and her gross income is $960. Now,
Sandy, someone mentioned that total countable income is listed as $631.50 on one line and $632.10 on another line.
was it in the previous? That may just be right. Okay, so there's the 632.10. Oh, yeah.
The previous example. Yes.
Yeah. Bad math on my part. I'm sorry. It should be the same number. It should be the 631.50. Okay, I apologize.
Thank you.
Sorry. Okay, so let's look at because this individual receives SSDI, again, which is a totally different box than SSI. We have to, again, we're looking at the SGA. We're looking at what the trial work period threshold is for the given year. Okay, so in her situation, if she's only working 12 hours a week, she doesn't come anywhere near the trial work period amount, the threshold. So it's just continuous. There's no change essentially. Okay, but if she works more, she would exceed the threshold, the trial work period threshold. She is not exceeding SGA, mind you, okay? But she is exceeding the trial work period threshold. So that is important because now we've started that clock. And remember, you only get one per disability, okay? And this is that year that money, it's kind of like the student earned income. You can make as much as you want without losing your cash benefit. Okay, so you basically have that year. Okay, so she would be engaging her trial work period. She would start succession. She would have the grace period, and then we would be in a totally different scenario. She would stay under SGA. Okay, but when you use your trial work period, again, it's one and done. Okay, this individual was in school. She was preparing for a profession, and she knew that trial work period was going to come in better to use later down the road when her income was higher. So she used this information that we discussed between working 12 hours now, working 30 hours now, to her benefit, right? She was able to use all of the information to decide for herself what was best for her and what worked out for her best financially. Okay. So, all right. We are so almost out of time. I'm so sorry. But, all right. So again, IRWIs, you see them in SSDI and in SSI. There is a list available. You can Google it. You have to keep your receipts. Again, those receipts have to go to Social Security. Social Security has to approve an IRWI. You can't just claim it and not talk to them and expect it to all be okay. It does not work like that. It has to be approved. Now, BWIs are for individuals who have statutory blindness. And BWIs are probably the most powerful work incentive. Because they don't have to be related to the impairment, which is pretty powerful stuff. So let's look. These are differences between BWIs and IRWIs. Medication is yes for both. Medical supplies, yes for both. Taxes is not an IRWI, but it is a BWI. Service animals, yes, that's for both. Pension deductions, not an IRWI but it is a BWI. Okay. Uniforms, no, not an IRWI, but it is a BWI. Physical therapy, adaptive devices is yes for both. Again, modifications, yes for both. Union dues is a no for IRWI, but is a yes for BWI. So, but think about it. The taxes that you pay are considered a work incentive for an individual with statutory blindness. It's pretty powerful. All right, there is a break-even point. It's the point at which you make so much that your benefit becomes zero, okay? What's the most important thing to know about this section? You can read this, but what's the most important to know is if your cash benefit becomes zero, that does not mean that you are exited from Social Security. You are not terminated, okay? Your cash benefit is suspended while you're making those dollars that you're earning, okay? But you're reporting every month, if you stop working for any reason, it does not matter why, your cash benefit will start back up the next month, okay? There is no jeopardy. Even if you work so much that you're a zero benefit, or you're not receiving a check anymore, okay? You're still eligible for SSI. That does not go away. Okay, very important. That's probably one of the most critical things everybody needs to understand. It's not, I'm going to make too much money and the benefit is gone. That does not happen. And 99% of people end up coming out better off when they combine the reduced SSI payment with their earned income. They come out ahead. Okay. And then they have that safety net that if they lose their job for whatever reason, that cash benefit is right there for them when they need it the next month. Okay. So, and part of that is because of what's called 1619B. 1619B is a law, okay, that says that regardless of the amount of your cash benefit, you retain your SSI eligibility and Medicaid. Okay, this is important stuff, right? So many people are worried about working in general because they don't want to jeopardize their Medicaid. Now, don't get me wrong, that $2,000 resource limit is still in place. That is still something that you have to work on. But there are work incentives that can help you with that. There's able accounts, there's different things that you can do, but you will not lose your SSI eligibility and you will not lose your Medicaid because of 1619B. Okay, powerful, powerful stuff. And no matter what you're making, right, if you go to zero, that doesn't mean it's zero forever. That cash benefit comes right back when you need it. Yeah, so I think I've pretty much covered this. Yeah, you just go into non-payment status, right? So it's not gone, you're just not receiving a payment. As soon as there's a change in your work status, because you're reporting every month, as soon as you report that to Social Security, that benefit check will return. Okay, I think we barely made it. I'm sorry.
Thank you. No, thank you, Sandy. I've been getting a lot of questions, so I'm just going to jump right in them. I know we have 3 minutes, and hopefully people can stick around to hear the answers to their questions. And feel free. I'm sorry.
It's fine with me if anybody wants to email me directly. And my work number's there as well, my cell number. I mean, go ahead. I'm fine if you want to reach out afterwards. Okay.
And I will put all of that in the chat box as well, so everyone gets your information, so you can copy paste it. So moving on to the questions, are individuals who were on HBWD and are currently working that obtain SSDI and they're switched to AABD allowed to have 401k accounts?
There is a service that can help with that, and there is a branch of Social Security that works with just those things, because it's going to be different. Again, when we start talking about individual dollars and individuals, it varies, right? Because it has to do with the amounts. Typically, a 401k is going to have significant impact.
Are gift cards unearned income?
Yes.
When considering income for calendar month, what happens when there are 3 paychecks in 1 month?
Well, again, I mean, are there 3 paychecks ongoing, or is it just that 1 month where there's 3 paychecks? If we're talking about SSDI, they're going to average. If we're talking about SSI, that would probably cause you to go to a zero cash for that month. But then it's, the next month, they're looking back 3 months, remember? So it's determined on a monthly basis, but they're looking back 3 months. So there would be an impact for that particular month where there were the 3 checks earned, but then it would level out as you keep going forward because you're continuing to report your income.
Thank you. Should a person apply first for Medicaid first and then SSI?
It depends on your situation. If you have a chronic health need, if you have specific disability impairments, if you are someone who needs Medicaid, I would start with Medicaid.
Okay. Do you have to report income that is less than $80?
Yes, you have to report any income.
Okay. When considering income for, oh no, I asked that. I'm aware of the ticket to work that individuals can get by calling a company. They could guide them through getting to work while they are on Social Security.
Mhm.
Do you have a list for them in Illinois?
Do I have a list of ticket to work agencies or companies, businesses? I do not for Illinois, but I can tell you if you use the internet and type in to Google employment networks in Illinois, that will be a good place to start. Those are going to be companies that work with Ticket to Work in your area. Okay. And you
I
can
will
basically
put
for Illinois.
I will put the link to the chat as well, the one that I just um, as a reminder, this is being recorded. The PowerPoints will be shared. You will be emailed once we archive on our YouTube channel. So if you have to go, you will be able to view this information as well. But I will just keep asking the questions because we had a lot of questions being asked. I have two disabled sons who are over 22. My husband is over 67 and collecting Social Security. My children are now collecting Social Security through him. Can they also collect SSI?
Yes.
Okay. Is there a break-even point for SSDI?
Um, it it has more to do with your SGA and whether or not you're achieving SGA.
How can I get both SSI plus SSDI?
Well, if you are, it's about communicating with Social Security. If you are, you SSDI is more of a, once you've made Social Security aware that, you know, that you are an individual with a disability, that you've reported that status, the SSDI, if you have earned income that you've paid into, that SSDI is, I wouldn't want to say automatic, but that would just kind of come more naturally than SSI. SSI you have to apply for, and it is a process.
What is the typical threshold for Medicaid eligibility? I know it varies by state, but just typically.
It does vary by state. I do not know what Illinois is. I can tell you that in Texas, it's something around $47,000 a year.
Great, thank you. Someone mentioned, I thought trial work period was for disability SS for $2,000 doesn't count. I'm not sure I understand the question. So if the attendee is still on, if you can clarify the question, that would be
The
great.
trial work period is about keeping all of your earned income without it impacting your cash benefit. The $2,000 cash resource limit is always a factor, always, in regardless of the trial work period.
All right, I hope I captured all the questions. Please let me know if you're still waiting for your question to be answered. I know there was a lot of information. It was recorded. PowerPoints will be shared. Sandy will be happy to answer private email, and I've posted her email address and work number there. So please let us know if there's any other questions that you have. We'll stick around for a couple more minutes and feel free to sign off. We will continue to record to make sure we capture all the questions that are coming in. Another question that came through is, how does unemployment or unearned income affect SSDI in terms of benefits?
How does
Here, I'll put it.
yeah, unearned income doesn't, once they calculate, you don't do a calculation like you do for SSI. They're not looking at that.
Okay, I think I've captured all the questions. Thank you for all of you who stuck around for the extra few minutes. Sandy, this was very, very, a lot of information, but super
No.
important.
And
And
and believe me, it's just we just scratched the surface, and I know I went really, really fast, and it is a lot of information, but I do appreciate everybody attending today.
so thank you again. And we will let everyone know once the webinars is up on our archive page on YouTube. And thank you again, Sandy. And hopefully you can, if there's any questions, participants will reach out to you. Have a great rest of the day, everyone. Thank you.
Thank you very much. Y'all have a good day.